You're listening to Convenience Matters, brought to you by NACS. Whether it's for food, fuel, drinks, or snacks, about half of the U.S. population shops at a convenience store every day. We'll talk about what we see at stores and what the future may hold for our industry.
It was only a few weeks ago there was a real euphoria when the vaccines were announced and approved. It felt like the beginning of the end of the pandemic. A couple weeks later, there are a lot of questions. How do you roll this out? Who gets the vaccines? How does it all work? It feels that there's more questions than answers right now. But in this podcast today, you will get more answers to your questions. Welcome to Convenience Matters. My name's Jeff Lenard with NACS.
And I'm Carolyn Schnare, also with NACS. And before we get started, I wanted to take a quick minute to dedicate this episode to those essential workers everywhere, and particularly those in our convenience industry. Convenience and grocery frontline workers have been working tirelessly since the beginning of this pandemic, courageously serving their communities. And also those supporting those store workers. We applaud you too for keeping the lights on, the shelves stocked, and for helping us keep employees and customers safe. So thank you.
Yes, thank you all. This is a special episode of Convenience Matters. When we do these special episodes, they are about something that is breaking news or very timely news. Normally, these are evergreen. We try to share ideas that stand the test of time, can be weeks or even months later. But for this one, we want to present information that is very timely. We're recording this on January 8th, and I say that is important just because things may change over coming days, weeks. If they change significantly, we'll record a new podcast. But for this one, we'd like to talk about vaccines and what the retail community needs to know about vaccines and their business. And for our conversation today, we'd like to welcome two people. We have Anna Ready-Blom. She's the Director of Government Relations at NACS. And Doug Kantor. He is with Steptoe and Johnson, which is the NACS legal counsel. They are both incredibly versed in the vaccine discussion and what you need to know. So thank you and welcome to both of you.
Thank you for having me.
Yeah, thank you for having us.
So we'll start with Anna. And want to start with big picture because I think the biggest question, well, I guess before we dive into the questions, give us the overall big picture about what's going on with the vaccines. How do they get distributed? What will be the process for retailers to pay attention to, and even suppliers?
Yeah, and that is the big question right now, Jeff. So what we have is, so the CDC, the Centers for Disease Control, they have an advisory panel who is made up of academics and medical professionals, and they were tasked with making initial recommendations for which categories of people are going to be prioritized for the vaccine. So answering those questions, looking at who's most at risk of dying, who has most at risk for exposure, and really come out with the federal guidelines and recommendations of who should be prioritized in that distribution plan and process. However, the biggest caveat is they aren't actually deciding who is getting the vaccines. That is being determined at the state level and at the local government level as well. So where we kind of stand is that the CDC has come out with their phase 1A, phase 1B, and phase 1C. And that's really where we are right now. And the states are trying to determine their individual frameworks and distribution plans.
And take us through like the 1A, 1B, 1C. 1A is essentially medical workers. 1B is essential workers in nursing homes, maybe depending upon the state, is because those are the terms that you hear more and more. 1A, Absolutely. 1B, 1C, and 2.
That's right. And it seems like it would have been a little easier if they called it 1, 2, 3 versus the 1A, 1B, 1C. But where we are, so the federal government, how they've defined it is in phase 1A, they are prioritizing healthcare professionals. So those treating the sick and vulnerable at the highest risk of exposure. And they also put in phase 1, those living at long-term care facilities. Next is phase 1B. And that is where they really looked at those two groups, essential workers and senior citizens. But but they get more specific than that. In phase 1B, they say frontline essential workers and seniors over 75 years old. Then they came out that same day, it was in December when they made that recommendation, with phase 1C, which would cover all other essential workers, seniors over 65, and then anyone who's at risk or has a high risk medical condition.
So Anna, when going back even up to March or April or so of 2020, you and your team were working to fight for convenience stores being essential/critical workers, or one or the other. And I know that we've, I think, said both words in this podcast so far. So can you define how we got there and then why we are where we are now?
Yeah, and it's so interesting because that work in early March by NACS in ensuring that the convenience industry was designated as part of this essential critical workforce, it is playing out now with the vaccine, like you mentioned. So what the Department of Homeland Security came out with guidance and definitions for who they consider part of their essential critical infrastructure workforce. And early on, we saw where that really played is it was guidelines that states looked at and many states followed and heeded in terms of which businesses could stay open and operating throughout the pandemic. And so now this CDC panel, when they were crafting the definitions for essential workers and really looking at who's frontline essential and who is all other essential, they were referencing the Department of Homeland Security's the definitions and categories that they had. So it really, they have been looking at that list. And what is key is part of the food and agriculture sector, convenience stores are listed in the first bullet. And the CDC panel considers the food and agriculture sector as part of the frontline essential workers. So next in line for the vaccine.
And when you, as you've talked about, it's a states issue. Does it get even that much more complicated for stores that have multi-state operations, for instance? And is there a difference between what a one-store operator might want to do and what a store with hundreds or a company with hundreds of stores might want to do? Is there any guidance that is uniform for both or specific and somewhat easy to take the next step with? I'll start with Anna on that, and Doug, if you have comments.
So unfortunately, it's not an easy process, as we're seeing. Many states are still working through that framework and plan, Jeff. So even though, you have these federal recommendations, every state is looking at it differently. And some states have even passed the baton on to municipalities as well. And so you could operate in that state, but have different guidelines in different cities in which you operate. And so it is tricky. And what we are really advising retail members and all members in our industry is to be in touch with your state association partners. The state associations are on top of this as well, and to really be proactive here in terms of reaching out to your local government, to your governor's office and health department to see where you are falling within those categories.
Yeah, and this is Doug. The next step, I think, is worth taking too, because Jeff, to your question, the world is much messier than anybody can lay out in as many 1As, Bs, and Cs as you want to string together. When this vaccine actually gets out there in broader numbers, it'll go to hospitals and drugstores and healthcare providers and others to administer. Well, none of them has a ready list of, who are the essential frontline workers in my community? Who are the old people? Who lives in a long-term care facility? None of us is really set up to do this in the way that that it seems to be laid out. So what Anna said about being proactive, we think is really important and goes beyond that. So for whether you're a multi-state operator or a single store operator, you can reach out proactively to those healthcare providers, hospitals, pharmacies. For example, I know there are a number of folks at the hospitals and otherwise that are compiling lists of people who are willing to show up on 30 minutes notice and take a vaccine because they have a vaccine that could otherwise spoil, and they want to make sure it gets put to some use before they lose it. And on top of that, just the basics of letting them know, hey, my workforce is designated frontline essential workers, as is all the convenience store industry. When is that going to be available? How can I work with you to make it easy to get my employees there, to get them through? All of those pieces of the logistics are going to be worked out at a very local level. And so it makes sense for everybody to do what they can to find out how they can make life easy for themselves along the way.
And I know, Carolyn, you have a question, but just to follow up real quick with what Anna said, if you don't know your state association, we can help you with that. If you go to convenience.org and scroll all the way to the bottom, there is something called, at the very bottom, we list our industry partners, and also underneath that, it lists related associations, and you can go by state and see who your state association is. Hopefully, you can say, oh, I'm a member. But that's where the information is. And sorry about that, Carolyn.
No, I was just going to follow up. Thanks. That was a really good clarification, Jeff. And I think you probably will give everybody's contact information out later. Anna or any of us can help put you in touch with that group as well. But one of my questions was going to be kind of following up to what you said, Doug, in terms of like, who are the people? Like, NACS and I worked with the Department of Homeland Security to develop emergency preparedness materials for retailers. And I think it made me think of one thing back when you're trying to get through a barrier because there's been an emergency or a hurricane and you're trying to get to work. We suggested having like company IDs that someone can show the police officer or the National Guardsman standing in your way between you and your store shift of, here, I work for, this retailer and I need to get to work, and to work with state and local officials to communicate those kinds of things. Do you know if that's something that might be what's in the minds of local health departments or states or federal, saying, is there a way to easily identify these essential workers? Because what's stopping me, Carolyn Schnare, from coming up and saying, I work for Joe's convenience store, I need an inoculation, taking away a vaccine from someone who really should have it first?
So that is a key question, and one that we get a lot, and actually is a reason why NACS is working with the state associations to get them templates so that they can ask their states and state governors for guidance as to what's the best way to document and show who those essential workers are. And we're suggesting to them a template letter that could go from individual convenience store companies and be given personalized to their employees to show that employee by name is in fact verified as an essential worker. Whether individual states want that or a different kind of documentation, we don't know yet, but we're doing all we can to try to put those ideas out there, again, to make it easy for governors and healthcare providers in the states and folks on the local level to say, okay, that makes sense. Then all I have to do is check an ID and see if it matches the letter, and we're good.
So I want to transition to some of the other elements. Once we have an idea of where the line is, depending upon the state, what do you need to do at the store level, and what are requirements that you might have with your employees? And just quick story, and it's horribly embarrassing and it's humiliating, but when I was much younger, I went to the doctor to get a shot, and I could have sworn the doctor said I was getting a TV shot. And I said, is it so you can tell how much TV I watch? And he said, no, you idiots, TB, tuberculosis, and he jabbed my arm. The humiliating thing isn't that I misheard TB into TV. It's that I was totally cool with him tracking how much TV I watched. But let's just say that there are some concerns, as we hear now, that people may not want the vaccine for whatever reason, because of health concerns, because of other concerns that their TV watching is going to be tracked. Are there things that that retailers may require or not be able to? And we'll start with you, Doug, on this. Can a retailer require or mandate that employees get vaccinated before they work in stores?
The short answer to that is yes. The Equal Employment Opportunity Commission has said you can require that. The long answer to that leaves me wide open to a bunch of lawyer jokes. So I'll try to give you the digestible middle answer. And the middle answer is, while you can do that, there are a couple of exceptions you have to make for your employees. One is if they have a medical condition, such as an allergic reaction, and don't want to take the vaccine for that reason, you've got to try to find a way to accommodate for that. You cannot force them to get the vaccine. And that may mean restructuring the workplace or doing some other things. And I can certainly talk more in detail about that. The second exception is a religious objection. If somebody has a legitimate religious objection, you've got to make an exception and try to find a way to accommodate that religious belief. Now, beyond that, there's a bunch of compliance advice that people may want to think about. The basic high level, I would say, is make sure you document why you feel you need to do this. Make sure you're consistent and you don't wink, wink, say, well, it's mandatory, but hey, not for you, Joe, you're okay. Being consistent across the board is important here. But again, the short answer is yes, it can be required. And frankly, I think a lot of employees will be pleased and reassured if employers strongly encourage or require it.
And we're hearing a lot about masks right now from members. There's some challenges. If somebody comes in without a mask, there can be a confrontation that accelerates. If they don't tell a person without a mask to wear a mask, they're hearing that that customers wearing a mask find that to be problematic and go on social media and threaten to never visit again. One thing, and this is a little bit in the future, but Anna, I will start with you on this. Once you have a vaccine, that does not change any requirements related to wearing masks or anything like that. So that would not change. Somebody would not be able to walk in a store and say, I'm vaccinated, I don't need a mask or anything like that. None of that changes this once the vaccines become much more rolled out, will it?
What we would recommend, it's a great question, Jeff. And again, it's, I think we're waiting to see what kind of immunity does the vaccine provide? What does it look like? But in terms of businesses operating, I would continue to follow the state, local, and federal guidance when it comes to masks and wearing cloth coverings and continue to institute that protocol in your stores.
To almost the same end, a lot of the store groups that we've talked to are using signage, stickers, placards to communicate mask mandates, whether by state or local requirement or by just company policy, hoping someone is wearing a mask. Do you think, and this is almost more hypothetical because every company is going to be different, and Jeff, you might want to even answer this. Do you think that it would benefit a retailer to say, my workforce is vaccinated, I guess, assuming they 100% are. Is there something that you would also think or recommend or even advise or just suggest that retailers communicate that they are receiving vaccines? The employees, might it make customers even feel safer? I didn't direct that at anyone. Jeff, I'm going to start with you from a communication standpoint. What do you think?
Maybe I'm sounding like a lawyer now, Doug, with advice you should not pay for. There's kind of a multiple areas with that. I think in some respects, it would definitely make customers feel safer, but in some respects, you don't want to ever appear that you're ahead of somebody in the line, whether or not it's your time or not. You don't want it to ever seem like I got it, you didn't. But then also on the other plus side is it certainly is a perk of the job in that it tells other people that you care about your employees. So it's a dicey one with communications, and I think it really depends. You have to know your market, and you have to know the room and read the temperature of the room.
Yeah, and Jeff, I'm so proud of you for thinking like a lawyer on this one, because it is a complex question, because you're now talking about, in some sense, your employees' medical information, and there's lots of restrictions around that. I think there's ways you ought to be able to do it, because you're not saying it with respect to any specific individual, and you can talk about your overall store policy and that sort of thing. But along the lines Jeff mentioned, from a communications point of view too, you may want to consider, while it may make some people more confident, feel more welcome, all that sort of thing, some people may think that they are not welcome in the store if they haven't been vaccinated. So a lot to consider there, but it's an excellent question, and one that I'm sure people will start to think about as we get further into this.
And thinking about the line, as our industry, we've heard maybe in as soon as February in some states, maybe as soon as January in some states, but certainly March, April, it looks like that 1A, 1B, 1C may be covered, Anna. What is the cost associated with that? I've heard things that they're free if you go through the government, but if you go through a healthcare provider or some other way, are there different things that retailers need to look at to mine the bottom line in terms of how you minimize your costs if there are cheaper options?
From our understanding and from what I have read, the vaccines should be covered and should be free. But that being said, I think that's something that we just don't know yet. I'll ask Doug. Doug, do you have thoughts on that one?
Yeah, so the vaccine itself is free. That much is very, very clear. Healthcare providers who administer the vaccine are allowed to charge a fee for administering the vaccine. Now, Medicare and Medicaid have said they're paying for that, so nobody should have to pay for that themselves. Most health plans, as far as I'm aware, have also said, we're paying for that. You shouldn't have to pay for that out of pocket at all. So in most situations, it in fact should be free, but the healthcare system is complicated. So as Anna indicated, there may be some exceptions to that out there because there can be this fee to administer. Hopefully, that's going to be covered in the vast, vast majority of cases, and it appears that it will.
Doug, you might be able to add something, because I have a question to follow up on that in terms of complications. Now, everything I've seen, read, it's all over the news. There haven't been too many complications with this vaccine to those that take it, but you never know. Once we start rolling out to a very large amount of people, the numbers will unfortunately go up. And say that an employer required you to get a vaccine, you have a complication. Is the employer possibly held liable for that, any complication that might result?
So we live in a very litigious society. So these are real questions. Somebody who has an adverse reaction who may have litigation, they may look at the healthcare provider, the vaccine provider, et cetera, although there's some protections for them in the law that may make it very difficult. It is possible, certainly, that somebody tries to then sue their employer if their employer requires it. One thing I would say is that when employers require a vaccine, there are multiple vaccines. I don't think it does anyone any good to try to impose on your employees which vaccine they should have to get. That could play into this question. So I tend to think that the risk is relatively low, that employers are going to be on the hook for any of those adverse reactions. But we are in a bit of an unprecedented situation with the EEOC even coming out and saying you can require this as an employer. So there are things that we may know more about, and some people may learn the hard way.
And Doug, we need to applaud Carolyn for thinking like a lawyer as well, because instead of saying, can you get sued? Yes, anybody can get sued for anything. I could be sued for this question.
Thank you, Jeff.
There's a difference between that and liability is the much bigger issue. So yeah, we're all thinking like lawyers today. But want to just kind of wrap things up, and I'll start with Anna. What is the big message that you want retailers to know after hearing this podcast? That what might they want to do? What might they want to think about as things go forward? And of course, as things develop, we'll have another one of these podcasts with Doug and Anna to follow up on latest news and what you need to know. But what's the big takeaway that you would like people to get out of this, Anna?
I think the biggest takeaway is that retailers really be proactive right now. Reach out to your state associations. If you don't know them, as Jeff mentioned, we're happy to connect you. Reach out to your local governments, but also reach out to hospitals, pharmacies, see if there are extra supplies of the vaccine. Explain that you are employing frontline essential workers that are playing a critical role in serving the American public right now, but in that role face more exposure because of it. And so the quicker we can get vaccinated, the better as an industry. And I think being proactive and being in touch with your state and local governments is a way to do that.
How about you, Doug?
I could not have said it any better than Anna just did. I will say the world is a messy place. We're in an unprecedented time. None of this is going to work as well as we would like it to work. It's going to be inefficient. So the best thing you can do is to be proactive and to advocate for yourself and your employees.
And I think, Jeff, I just wanted to share some ideas and some resources for folks. In addition to what Anna and Doug said, is that while this episode is primarily directed to those with employees in the convenience retailing industry, every industry is different. But from our perspective, from the NACS perspective, we certainly have the NACS Daily, which comes out 5 days a week. So if you're not subscribed to that, go to convenience.org and get subscribed, because we will put information in that as soon as we know, especially as breaking developments come out that relate to you guys. And then also at convenience.org/coronavirus, we have tons of resources, and we'll post anything we know there, whether it's templates. I think, Anna, you might be able to tell us if on the government relations side, those might be there as well, but we'll list them in NACS Daily and at convenience.org as well.
And there's a button on Convenience Matters if you have a question that you'd like to ask for us for a future episode talking about vaccines. If it's important to you, it's important to us, and we will get you answers. So thank you, Anna. Thank you, Doug, for joining us today. And thank you all for listening to Convenience Matters.
Convenience Matters is brought to you by NACS and produced in partnership with Human Factor. For more information, visit convenience.org.